Singapore reported 5 confirmed cases in the community. All were linked to previous cases and were already quarantined. 11 other cases were imported, with 6 detected when they arrived here and 5 developed COVID-19 during SHN or isolation. More details will be released tonight. You may have noticed that from last night, the Health Ministry has changed the way it reports COVID-19 details in its daily updates to the public. Apart from the case numbers, MOH will no longer provide the profile of each new case in the community, like their age and occupation, as well as the places they visited and the dates they tested positive. Instead, the new format focuses on key trends for local and imported cases, the number of active clusters being monitored, severity of the patient's conditions, and progress made in the nationwide vaccination drive. For a closer look, Professor Teo Yik Ying joins me now. He is the Dean of the Swee Hock School of Public Health at the National University of Singapore. Welcome back to the show, Professor. What could be the motivation behind the changes? Is it no longer necessary for the public to know the details of the confirmed cases, for example, like the places they visited?
Thanks for having me. Actually, the change is very much in line with the plan that was announced by the Multi-Ministry Task Force, the 3 ministers, to progressively move towards seeing COVID-19 as an endemic disease, where there will be increasingly less emphasis on the number of daily cases and where people were exposed at. By not releasing the details of the individual cases, we are sending a very clear signal to the public that as we continue to vaccinate more and more of our people, it is increasingly less important to know where and when people were infected, and instead shift our focus to whether these infected people have developed severe symptoms and whether they were hospitalized. So the new format clearly outlines some of this information as well as the status of the vaccination rollout in the country. So the reality is that as more and more people are vaccinated, we may become less focused on whether these people have been infected or not, especially since the vast majority of the infected people, because of the vaccine, are asymptomatic or at most have mild symptoms. And this is exactly the kind of protection that we expect the vaccine to provide, that vaccinated people, when they do become infected, never really develop severe symptoms that require hospital care or leave any long-term impact to their health.
And Professor, by focusing on key trends, clusters and vaccination progress, how useful will this new format be for people in general?
So certainly I believe this information will be a useful update to the population in terms of the number of people that have been vaccinated, the number of people who experience severe symptoms that are hospitalized in high dependency wards or in ICU. Or are they mainly the unvaccinated people? I think this helps to address some of the misinformation that is still circulating in social media, essentially around the value of vaccination. By clearly showing that through data, through the real world data that we see in Singapore, that vaccinated people are much less likely to experience harmful effects when infected, because the vaccine is protecting these people from severe symptoms that require hospital care. This is exactly the kind of information that helps to strengthen the confidence in the vaccine and to encourage those who have yet to be vaccinated to come forward and to take the vaccine. And I see this to be very important as we move towards treating COVID-19 as an endemic disease. Because when the key trends are able to show that infection numbers may continue to increase, but because the vast majority are asymptomatic or have very mild symptoms, and that the vast majority never require any short-term or long-term hospital care, this is exactly the kind of signals that tells us we can now relax many of our restrictions, especially when the uptake of the vaccination continues to increase in the population.
And on that note, Professor, what about on the national level? How will this new focus shape future policy-making decisions relating to COVID-19 matters, for instance, on the air travel bubble arrangements perhaps?
So earlier on, I talked about how we intend to treat COVID-19 as an endemic disease. And this means that COVID-19 is going to stay in Singapore very much like influenza, very much like dengue, and that we will have a baseline number of people who will be infected with COVID-19. This number will be mostly low most of the time, but once in a while, we may see surge in the number of cases in the country before the numbers come down again. But what we're looking for is really because most people in the population will already have been vaccinated. I talk about the number of infected cases will mean that even though we have a lot of COVID-19 cases in the population, we don't actually have many COVID-19 patients in the hospitals seeking care because most of them will be vaccinated and they have mild symptoms at most. And this is when, as a country, we become confident we are able to allow our lives to return to near normal with very little restrictions on what we can or cannot do. And you talk about our travel, our ability to travel overseas, whether it is for work or for leisure. And because we have been vaccinated, that's the long-term game plan that Singapore, as well as many other countries, are aiming for when we talk about living with COVID-19. But presently, we are not there yet because we still need more people in Singapore to come forward for their vaccination. And we need to constantly keep an eye on what is happening globally, whether new variants are emerging that will challenge our plans. But at the moment, I think it's suffice to say that the present scientific data shows very clearly that the vaccines that we are using in Singapore are very effective in protecting us against the severe effects of COVID-19 infection, even against the more transmissible Delta variant. And that's where I expect the new format to become useful, to continue showing that as vaccination number increases, the number of infected cases may increase, but this will have less impact on the number of people who require hospital care.